welcome to the System Design and Management webinar series. The System Design and Management program is a mid-career master's degree program that's jointly offered by MIT's School of Engineering and the MIT Sloan School of Management. The System Design and Management program provides a systems thinking perspective that integrates management, technology, and social sciences to address rapidly accelerating complexity and change in today's global markets. Graduates earn a Master of Science degree in Engineering and Management. The SDM program also offers a one-year certificate in systems and product development. We're very pleased to have Andrea Ippolito present today on how to build a culture of innovation through design and systems thinking. Andrea Ippolito is a Presidential Innovation Fellow based at the U.S. Department of Veterans Affairs Center for Innovation. A PhD student in engineering systems at MIT, she co-founded Smart Scheduling, a software firm specializing in medical appointment planning. She's also served as an innovation specialist at the Brigham and Women's Hospital Innovation Hub, co-led MIT's Hacking Medicine, been a product innovation manager at Athena Health, and a research scientist within the Corporate Technology Development Group at Boston Scientific. As an SDM alumni, she holds a master's degree in engineering and management from MIT. She also holds a Bachelor of Science and master's degree, both in biomedical engineering, from Cornell University. Andrea will present today for approximately 45 minutes, and then we'll open up the webinar for questions. Please use the chat feature on the webinar to ask questions, and we'll respond to as many as possible. Please join me in welcoming Andrea Ippolito for her talk today.
Well, thank you so much, Joan, for that really kind introduction. I'm really honored to be here with all of you today and look forward to the discussion at the end, so thank you so much for joining. So as Joan highlighted, currently I am working as the Innovators Network lead and just finishing up my role as a Presidential Innovation Fellow at the Department of Veterans Affairs. And one of the reasons why I came to the VA is I felt this strong sense of performing a tour of duty in the United States government, and I'm truly honored to be at the Department of Veterans Affairs serving veterans and their supporters. So thank you all so much for joining today's call. So to give you an overview of today's agenda for the next 45 minutes, I want to give you an overview of our motivation for creating a culture of innovation at the Department of Veterans Affairs. Also describe the role of human-centered design and design thinking in the stand-up of this initiative, along with thinking about the role of systems thinking. Also, I'd like to provide an overview of what we end up designing and developing and deploying, which is called the VA Innovators Network, and also describe an open innovation strategy that we employed as part of this broader initiative. And I'm hoping with these examples that you can use these to design and help support whatever innovation strategy your organization decides, whether it's in healthcare, it's in government, it's in the military, it's in consumer products, because I believe that these can translate well across a number of different domains and industries. And then at the end, we'll have 15 minutes for questions, and I look forward to that discussion. To review some of the goals for today's presentation, we really want to highlight how you can apply design thinking and systems methodologies to improve the innovation culture within your organization, and also the tips and strategies that you can use to help build an innovation network at your organization, no matter what the domain or industry. And also review some of the open innovation tools that your organizations can use that are at your disposal, some that are more affordable than others. And so I'd love to strategize with all of you and have a discussion at the call on how you can use open innovation to really open up the walls of your organization and really harness the power of the crowd. So to get right into it, the VA has faced incredible opportunities and challenges over the past 2 years. I'm sure as many of you know, the VA was in the news quite a bit this past year due to some information coming out of our Phoenix VA Medical Center, among others. And I see this time at the VA as a tremendous opportunity to think of ways that we can improve the experience for veterans and their supporters. And I think the VA does a tremendous job in serving veterans, but we need to do a better job in a number of different areas. And Secretary Bob McDonnell, who was the former CEO of Procter & Gamble, came in mid last year, and he really sees this as an incredible time at the VA to think about how we can imagine and develop the best possible experience and services for veterans. So I'm truly honored to be there. VA is a huge organization with over 152 medical centers, over 800 community-based outpatient clinics, over 50 regional offices that help deploy benefit services to veterans. And also we provide lots of end-of-life care through our National Cemetery Administration services. So the role of VA is vast. It's the largest integrated healthcare system in the country, and it serves a tremendous number of veterans, over 9 million in healthcare services alone. And we really want to go out and, with the lens of innovation, understand how we could deliver the best possible innovation experience for our employees so they can then deliver the best possible experience for veterans and their supporters. So to do that, we went out on the road and we traveled across the country to understand what the current innovation experience like for our employees, because Secretary Bob and our organization believe that the best way we're going to be able to serve veterans is by serving our employees. And if we can't evolve and really innovate as an organization, there's no way that we'll be able to evolve in delivering the best possible experience for veterans. So we went out on the road and we deployed a research strategy and a methodology that has been highlighted quite a bit in not only business schools but in the media, because it really does help ground you in understanding what the current experience and problems and ways to move forward are. And the methodology we chose to use is human-centered design. And I'll tell you a little bit more about what human-centered design is if it's a strategy that you're not as familiar with on the coming slides. And what we use human-centered design research is to interview our employees to understand what their current experience is like. And we went from Georgia to Pennsylvania to Colorado to the Pacific Northwest. And we use the findings from this work to design our innovation strategy. Now, to take a step back, I really wanted to take some time to describe what is human-centered design. And to put it simply, it's the methods and principles to discover and address the needs of users. In this case, our users were employees, and ultimately would like to serve veterans. So we started with our employees. And ultimately, you're trying to answer these two questions. What are the gaps in your current system or product or methodology or process? And how does it do the job right now? And what are the different ways and strategies that you can design to meet the needs of your users? And there's a couple of principles that, at its core, human-centered design follows. It's this concept of designing with empathy. To put it simply, it's putting yourself as the designer of this new strategy, service, product, whatever it might be, in your user's shoes and understanding it from their perspective. And this oftentimes forces you to be quite humble. So when we were doing a similar human-centered design research last fall, we went out on the road to understand what the current experience was like for veterans accessing VA services. We had a VA employee on the road with us, and she was asking a veteran how she likes to use these services. And the veteran answered in a way that was unexpected for the employee, and the employee in a debrief after said, well, the veteran got it all wrong. This is how you actually access the services. And it actually forces you to be quite humble, because it's like, no, this is the veteran's experience with this service and product. And even though maybe they're not using it how it was designed, this is how they're experiencing it. So it forces you to sometimes hear some hard things about things that you've been very involved with as maybe an engineer, or maybe as a product manager or a leader. So it really forces you to go out and understand the experience and be quite humble. And the second strategy that human-centered design deploys is building an iteration. It's really critical that once you understand the current experience and have developed an initial design or MVP or minimum value product, that you then go out and show that draft early and often and obtain feedback. There's many quotes out there. Reid Hoffman has a quote, if you're not embarrassed showing your product or service, then you're too late. And this at its core is what human-centered design is trying to tackle, is this notion that you're building in iterations, you're getting your draft designs out there early enough then to obtain feedback. And this was a huge, huge shift at the VA and in many government agencies. VA traditionally has been very business-centered, so very much driven by stakeholder requirements that we put out in the form of a contract, and we push through some procurement cycle, which oftentimes can take months, if not years. Oftentimes, user input comes much later after we have deployed a contract. And oftentimes it happens in very long cycles and is completed based on capacity. Whereas what we're trying to do with this user-centered approach is that it's really driven by the needs of users. And throughout the process, it's tested and built and co-designed with users, and then it's constantly getting iterated upon. So this was a new approach in the federal government, even though many other agencies such as USAID and Health and Human Services are starting to grab hold of. But nonetheless, this is an approach that we are moving forward with. And as I learned as a system design and management fellow, is it's really important to understand why this is important and how you communicate this to users and your fellow employees. So at its core, what human-centered design does and helps with is it's a great way for you to design your services and tackle your goals and strategies for your product development, system development, or strategies that you're looking to design. And it's a way to match that with unmet needs of your users and do it, hopefully, in a sustainable way. And human-centered design projects over and over and over again across a number of different organizations, because this is definitely not a new concept, have shown that by using human-centered design, it helps increase the adoption rate, and that it also helps prevent rework down the line, and it also ends up becoming a lot more financially stable product because you increase adoption and you also are reducing your product development cycles because you're constantly designing it with your users in mind. So as you proceed forward with any human-centered design project, and if you are experiencing pushback from your leadership or fellow employees, just bring it back to these points because this was instrumental in us really deploying human-centered design at the VA. So the overall process for using human-centered design or user-centered design, because often they're used pretty interchangeably, is quite simple. It's first understanding the current experience and using research strategies such as interviews with your users or other stakeholders and asking open-ended questions to understand their experience and not biasing them with those questions. Second is then taking the findings from your research phase when you went out to understand what the experience was, and then using those themes and findings that you've synthesized to then co-design with your users and stakeholders whatever the draft is of the initiative that you're trying to do. And then the third phase is testing it and getting feedback throughout. Fourth is then building whatever that draft design that came out of your testing phase is, and then delivering it in the fifth and final phase. But as you can see here is that it doesn't just stop there. It's constantly getting tested and further built and iterated upon even after you delivered it to the enterprise. So this is the methodology we used. We went out and we did research, and we came up with a number of findings. At its high level, we found that employees really desired a networked organization because the VA is so big with 152 medical centers and over 800 clinics and a number of different regional offices on the benefits side of the house. Employees really desired a networked approach to really communicating with their employees, and they were often sick of this command and control hierarchical structure that you see in a lot of large organizations. The VA is a large organization, and with that comes a lot of bureaucratic processes and policies, and often innovation was stifled because people didn't know where to go to obtain resources for a new concept that could help deliver the best possible services for veterans. And also, they weren't sure on how they could test it and if they were allowed to take this risk, and often they were pretty nervous to take this risk. Also, innovation was challenged by what they call the devil's triangle of hiring, contracting, and IT, which I'm sure many of you have seen in your organization. And our employees were really nervous to step outside the box, especially after VA being in the news a lot last year. VA employees were nervous to take a risk on something, even though it ultimately could most likely help their veterans, but they didn't want to be on the front page of their local newspaper, and it was a risk to them in thinking about how they can design new possible services. I'd just like to note, most VA employees are truly driven by the mission, and so it's just a real honor for them to serve veterans. And after that scandal that happened in the news, a lot of them not only felt terrible, but they also were nervous on really how they could step outside the box. So they were really looking to innovation as an opportunity to help not only empower our employees, but also to help deliver the best possible services to veterans. And because our employees are dealing with an influx of veterans that are coming into the system, oftentimes they're quite overworked, and especially with all the news headlines, they were feeling quite unappreciated, despite the fact that you see number 6 that they really were proud to be serving veterans and be VA employees. So based on this research, we then took these findings and we then co-designed and developed this concept of the Innovators Network, where our vision was to build innovation as a competency across the VA to develop the best possible customer and employee experience for veterans and their supporters. So at the core of what we're trying to do is we were trying to build the innovation muscle of the VA so that we could more agilely respond to veterans and their supporters' needs. And with this, we took 2 approaches, and I'm going to describe them both on this call. The first is focused on how we could design a strategy to build the innovation muscle of the VA that was internal to the VA, and this was called the VA Innovators Network. And then we also wanted to think about how we could work with the public and the citizens of the United States and the crowd on how they could get involved with delivering the best possible services for veterans and their supporters. And I'm going to give you one example with our development of the Prosthetic and Assistive Technology Challenge. So with the first strategy, which was internal to the VA, our goals were simple. So deliver value through innovation to VA's customers by enabling VA employees and really building innovation as a muscle across the VA through coaching and training programs to allow VA employees to be more effective, more productive, improve employee satisfaction, and in turn deliver the highest quality care for veterans and their supporters. And thirdly, we wanted to amplify the innovation ecosystem in and around the VA. We know that folks want to help serve veterans in the community, and they didn't know how to really interact with the VA, especially at the local level. So we're hoping the Innovators Network is a great way to not only build the innovation muscle of our employees, but also of the surrounding ecosystem and how they can also work with employees and veterans to develop new services, technology, and experiences. And the main components of this Innovators Network are quite simple. We stood up this capability, this position called an innovation specialist based at our medical centers. And these innovation specialists can then work with employees to co-design different, whether it's a technology solution or services or experience with veterans, and then give employees a certain percentage of their time to work on these innovation activities. The third component was we want to arm them with actual funding and resources to support these innovation projects through tiered funding. And we describe a little bit more what these are in the coming slides. The fourth is providing innovation training and toolkits. And one of the core competencies that I know Secretary Bob wants VA employees to have and use in their daily activities is that of human-centered design. So at each of our Innovators Network sites, we're deploying human-centered design training so that our employees can more rapidly and agilely respond to both veterans and employees' needs. And we're arming them with human-centered design toolkits so that they understand how they can use human-centered design in practice. The fourth is that we needed a way to actually keep track of all of these innovation projects and also find a way to help keep track of the footprint of this Innovators Network. So we deploy Salesforce in two different ways. The first is when our innovation specialist meets with someone, whether it's internal or external to the VA, they log it in Salesforce, which is a surprise to some folks, but it's a great way for us to keep track of the footprint that we're building with the Innovators Network. The second is we're using Salesforce to actually keep track of our projects. One of the things we heard in our research is that employees often heard about the exact same technology or service that was developed at our Portland VA Medical Center that was deployed at our Atlanta VA Medical Center. So we wanted a better way for employees to understand what's already been developed and tested and then be able to more rapidly export that. So we're really increasing the diffusion rate of innovations across the VA. And we found the best way to do this is through a Salesforce platform to help keep track of all of these projects. And then the fifth strategy we're deploying, and it's quite simple, is applying innovation awards. And one of the things we heard from our employees is they often don't feel recognized for the great work they're doing. And so we really wanted to celebrate innovation. And we're in the process of deploying innovation awards at different sites across the VA. One thing I wanted to go into a little bit more depth is how we're using tiered funding mechanisms. So oftentimes in many large organizations, and especially in the government, the way that we deploy money is in large boluses, and they're often in terms of procurements, large procurements. But we needed a better way to help build up to these large boluses of money. And we needed a more agile way using human-centered design to actually allow employees to engage with innovation and create a lightweight way for them to eventually build up to. So we're about to launch these tiered funding mechanisms, which we've called Spark, Seed, and Spread. And the notion is that there are 3 tiers of money, and they build off one another. So the first tier of money is $5,000 to $10,000 that's aimed at proof of concept projects. And these projects are for employees so that they can test out ideas that have a strong theory of action or some small bit of evidence, but they want to build a small prototype that would cost around $5,000 to $10,000. Once it's shown value at this spark level, this proof of concept level, that they then can apply for a second tier of money in the seed phase, around $50,000, to actually pilot this project and show an effectiveness at one site. Then, if it's shown value at this one pilot site, that they then can apply for a larger sum of money to actually spread or diffuse this innovation. And this dollar amount is in the 100 to 500K. So this is a dramatically different model than the VA was used to, that we're really building up to these larger investments of money. And we're hoping that innovations can fail fast or learn fast, and then they can evolve from there. This is not new to the federal government. Department of Education deploys this strategy in their efforts, and so VA is lucky to have such great federal partners to learn from. So what we're doing this year is piloting this Innovators Network at several different sites. So right now we're up to 7 sites, and we're about to add an 8th site in Chillicothe, Ohio. And as you can see here, a lot of these sites aren't in technology hubs. Some are, such as in Boston, San Francisco, and to Portland. But what we're really trying to do is really build the innovation capacity of the VA so that they can become these innovation epicenters within their local community for those that really want to interact and serve veterans. And in order for us to select the pilot sites, and this is an important lesson for other organizations, is we really want their leadership and their employees to be bought into it. So I'm based at the VA Center for Innovation, and we launched a request for applications that was under 2 pages, very short, for each medical center to apply to become a pilot site of the VA Innovators Network. And their leadership had to write a letter of support. And this was really important because we knew that we weren't going to be able to be successful unless we had the support of their leadership. We ultimately selected 7 sites, and with these 7 sites, I've shown some examples of different projects that they're focused on. So the Milwaukee VA Medical Center in Milwaukee, Wisconsin, is focused on a collaboration with the Mayo Clinic, where they're thinking about how we can improve the model for healthcare so that it's minimally disruptive on patients' lives. Oftentimes, many veterans are on 5 or more medications, and they have to go to the doctors, and they have to travel a couple of hours, and they have to log all these different tests and go to a number of different follow-up appointments. And all of this healthcare is actually quite disruptive to their lives and their quality of life. So Mayo Clinic has really pioneered this strategy of minimally disruptive medicine and actually treating patients in a holistic manner so that we understand how to best treat patients so that it is as least disruptive as possible on their lives. One of the other things that San Francisco VA Medical Center is piloting is opportunities to unburden the provider. You hear on the news quite a bit now that doctors often are documenting 1 to 3 hours a day. And if you think about an average 8-hour workday, even though many clinicians are working many longer hours, this eventually becomes an access issue because clinicians are documenting so much and having to do so much administrative tasks that this really removes time from their schedule to see patients and also spend more time with their patients to have more active dialogue to deliver the best possible care and services to patients. And so San Francisco VA Medical Center is taking a hard look at how we can really unburden the provider so that we can do a better job and spend more time with our veterans. A third strategy that the Boston VA healthcare system is taking is they're rolling out innovation catalysts. So we have this position called an innovation specialist at our pilot sites, but we want to find a way to force multiply what we're doing at our medical centers. And we know that people are looking to learn innovation and also find ways to grow their skill sets and get taught and trained on different innovation-related competencies. So what they're doing in Boston is teaching and training a number of employees across the different service lines on innovation activities such as human-centered design to really force multiply that one FTE that Boston has so that there is 10-plus FTEs that can speak the innovation language and help empower employees with innovation. So that is an overview of what we're doing with the Innovators Network internal to our enterprise, and I'm happy to answer any questions at the end. What was really important to us next is thinking about how we can begin to engage the crowd. And we wanted to test it out with an area of opportunity that is facing many of our veterans. So along the way of my journey at the VA, I have the wonderful opportunity to meet 3 rehabilitation engineers at our Richmond VA Medical Center. And the role of these rehabilitation engineers is they are technologists, they're engineers that work directly in clinical settings, and they work directly with patients and clinicians. And in the VA's case, our patients are veterans. And they hear their specific needs, and then they work with them to design different technologies to help support them. In particular, they work with veterans that are disabled, many of which are amputees. Amputees have unique challenges, such as not being able to reach the light switch in their home after an amputation, or not being able to reach those buttons on the microwave, or not being able to walk and do the same sorts of things that they used to prior to their amputation. One of the veterans that I had the incredible honor and pleasure to work with is Eric Young, who you see on the screen. He had an upper extremity amputation of his right arm, and Eric is a very avid photographer. He loves taking pictures with his SLR camera, and since his amputation, he was not able to proceed forward with taking pictures like he used to. Also, Eric loves to ride his motorcycle, and you see him wearing his Harley shirt there. And since his amputation, he's not been able to ride his motorcycle. So we have these incredible rehabilitation engineers at the VA that work with veterans like Eric to design these technologies and services that are specific to their needs and also help improve their quality of life. But the problem is there's only 3 rehabilitation engineers at the VA, and it's the largest integrated healthcare system in the country. And so how could we as a VA work with the public to think about how we could design these assistive technologies that are personalized to veterans and their needs, and really work with the crowd and citizens to actually engage with veterans and exact services that they need to meet these needs. So our vision was to launch this series called the VA Innovation Creation Series to accelerate the development of personalized assistive technologies to improve the care and quality of life for veterans that were faced with disabilities. And specifically, we were focused on how we could engage the crowd in designing prosthetics and assistive technologies. So we put this challenge to the crowd. We launched this Open Innovation Challenge on May 15th in Palo Alto at the VA Medical Center there. We made a second stop at the National Maker Faire in D.C. that was part of the White House's Week of Making. And the third stop in our series was we had a Make-a-thon event at the Richmond VA Medical Center. So our overall vision here was to open source the designs from this VA Innovation Creation Series. And then we hoped that folks would really engage in the growing maker movement across the United States. So if you haven't heard of the maker movement, it's really focused on folks across the country that are at its core into making, whether it's 3D printing or rapid prototyping or sewing. It can take a number of different forms. But specifically, we really challenge the crowd to come up with 3D printed or additive manufactured designs that could then be open sourced. And the vision was at this Make-a-thon event on July 28th and 29th that the different designs that came out of the entire series would then be co-designed and iterated upon directly with veterans at the Richmond VA Medical Center. And along the way, we had the incredible opportunity to collaborate with organizations such as GE and Google.org and Toyota and America Makes and the Girls Lounge, which really helped us not only force multiply what we were trying to do, but also work with their incredible engineers and supporters to help co-design these different devices. So what we did to do this, because we had these incredible lineup of in-person events, but they were only in 3 locations across the United States, and that was not going to be enough for us to really achieve our goal and really engage the crowd. So what we did is we took some specific challenges that veterans were facing, and we put them on 2 open innovation platforms. The first, which is shown on the left, is GrabCAD. And these open innovation challenges that we put out took the form of, we challenge you, the crowd, to create an attachment or an accessory for a prosthetic arm that will improve the user's quality of life. Because oftentimes the prosthetic arms have an attachment that's just a hook. And veterans actually like using the hooks because it's easy to use. But when it comes to taking pictures, like using an SLR camera, the hook doesn't do the job. So the ability to attach an accessory to these prosthetic arms was a huge opportunity to help improve the quality of life for these veterans. So some examples that we had seen from our collaborator, Walter Reed, are in the Baltimore area, a veteran that had an upper extremity amputation. Walter Reed designed him a claw that would help him better eat crabs because he's from the Baltimore area, and it's an important part of what he loves. And so this challenge was out there so that we could get a number of different ideas for end limb attachments. Through this challenge, we actually got over 150 designs, and we were very lucky to work with the collaborators at GrabCAD to host this challenge. And how it worked is we put out this challenge, and then people could upload different designs, and then if they were one of the winners, they received a small monetary prize. The second platform we used was InnoCentive. And InnoCentive works in a very similar way, where you can post challenges out there to the community, and then solvers from across the world can submit different ideas and designs. And to obtain access to this platform, the federal government has a number of different subject matter experts. But one of them in particular that has led the way is NASA. The NASA Center of Excellence for Collaborative Innovation has launched an incredible number of challenges that have reimagined spacesuits, that have allowed for 3D printing habitats on Mars, or obtaining the designs for different 3D printed habitats on Mars. And so at the VA, we were very lucky to collaborate with our partners at NASA for them to teach and train us on how to use this InnoCentive platform, which works in a very similar manner as GrabCAD. And as you can see, the awards are shown here on the screen. We offered an award of $10,000, and we obtained dozens of designs. So both of these strategies, while not pennies, they're actually very cost-effective strategies that your organizations can use to obtain access to the incredible brilliance of the crowd. And then the key is then, as your organization works with these solvers in the community, is thinking about how you then take these designs and bring them back into your organization to get tested and implemented. And so for us, that first step on that journey was with the Make-a-thon event at the Richmond VA Medical Center. To highlight another one of the challenges that were posed to the crowd, I'd like to introduce you to Lisa Marie Wiley. She is actually an active duty sergeant in the United States Army. She's transitioning out of the military right now, and she will be a veteran shortly. As you can see, Lisa Marie has an amputation on her left limb, and she stepped on an IED in Afghanistan. And while Lisa Marie is extremely tough, Lisa Marie weighs 100 pounds, and she is looking to have a baby in the coming years. But she finds that the prosthetic limbs really don't fit her that well, because she weighs 100 pounds, and a lot of the prosthetic limbs that are out there are designed with the male body in mind, and they're a very one-size-fits-all model. So the limb that you can see Lisa wearing right there is actually a child's limb, and it doesn't fit incredibly well. And oftentimes it can take up to 20 minutes for Lisa to switch in and out of her different prosthetic limbs to perform different activities. And this is a huge burden on her day. So this is Lisa actually pitching to the crowd at Richmond on how we could create an open source coupler design so that folks like Lisa, veterans, active duty service members, or anyone that has an amputation could attach this coupler to their prosthetic device to allow them to more easily switch between their prosthetic limbs. So Lisa positioned this challenge to the crowd, and we were very lucky that an incredible FIRST robotics team and engineers from the community worked with her to design this with feedback and input, not only from Lisa, but also from her supporters and her fiance, so that they could come up with this coupler design. And we were very fortunate to work with Google.org, who was very generous to support the prize winners coming out of this challenge. And this coupler design is actually open sourced on this incredible platform called the NIH 3D Print Exchange. And our vision here is that veterans, service members, or anyone that has an amputation or disability across the world can go to the NIH 3D Print Exchange, can download these designs, and then work with the makers in their community, whether it's the growing number of 3D printers at libraries or tech shops or other maker shops, to then co-design and adapt these designs to meet their specific needs, and also make sure that they fit. So our vision was to really force, multiply, and amplify through this platform. And in the process of this, we obtained incredible support from the media and community, including the Washington Post and ABC and Fox, and military.com, and among other local news sources as well. And this did wonders for the VA, not only in helping to better serve veterans, but also helping to empower our employees, because the past year has been really tough on the morale of VA employees. And the best way we know we're going to be able to serve veterans is by really empowering our employees. So this challenge accomplished a number of goals. One other challenge I wanted to highlight is we ran a smaller scale event at our Atlanta VA Medical Center called the Health Innovation Challenge, where we gave the opportunity for employees and outside innovation stakeholders to come to the Atlanta VA and come pitch different challenges that are impacting veterans. And in particular, you'll see on the screen here a picture of Dr. Ma. Dr. Ma is an ophthalmologist at the VA, and oftentimes when she sees veterans that come into her clinic, it's too late because they're already blind. So she pitched this problem to the crowd, and two Georgia Tech engineers came up to her and throughout a weekend in the form of a hackathon at the Atlanta VA Medical Center, they came up with an initial prototype for how you could predict blindness using retinal images scanned in primary care settings. And over the course of a 2-day hackathon at the Atlanta VA Medical Center, they came up with an initial prototype. And then Google found out about the challenge post the event, and within 5 months of the event, they're already moving towards clinical trials. And in the healthcare sphere, this is unheard of, this rapid pace of how you can design technologies and services. So the VA is looking to take a really strong stance on how they can work with the outside world to really design the best possible services and experiences for veterans. So shamelessly, if any of you on the call would love the opportunity, we would love the opportunity to work with you, because this is an opportunity to serve your country, and most importantly, veterans that have been and given so much to the nation. And so this is a great opportunity for you to engage with them, and also hopefully generate some incredible innovations, whether it's in healthcare or benefits or services more broadly. So with that, I'd love to open it up to questions and also discussions.
So if you have any questions at all, please use the chat feature on the WebEx. If you use that and able to send it over, please click everyone when you send that out, and I will read the questions back to Andrea and let her respond back to that. Also note, as Andrea just said, she has posted her email address on the screen right now, and so you can also feel free to get a hold of Andrea with any specific questions, or as she was saying, any interest in helping out with some of the projects that are going on. So I have a question here that says, how many experts of what type do you have centrally to support the innovation like this? How do you translate prototypes to operations?
Yeah, it's a great question, and thanks so much. So one of the vision for the Innovators Network, and this is related to the first question, is that the experts are all across the VA. I mentioned the locations and the breadth of what the VA does is quite large in scope. But the problem is employees don't know where to go to find these incredible experts or knowledge owners across the VA. So one of our goals with the Innovators Network is that these innovation specialists that are located on site at these medical centers can serve as the hubs for the local medical center when someone does have a question about a different core competency that maybe they don't know where to go to at their medical site. And the notion is that these innovation specialists are very tightly linked across the VA, and that they can really reach out to their collaborators across the network to engage on and ask questions on certain topic areas. And the way we do that is we use the Jive platform, which is a platform that allows folks to feel connected across the enterprise. Our internal version of it is called Pulse. So oftentimes the innovation specialists will post out specific topic areas or questions that one of their employees at their sites have, Also, another area that Pulse or the Jive platform helps with is that we can set up different competencies or topic areas so that as a community starts to form, whether it be in ophthalmology or with transitioning from the military, these different topic areas are created on our Jive platform so that people can go to these different communities and interact and network. And the second question, Joan, if I heard it correctly, is on then how we can then implement some of these technologies. Did I hear that correctly?
How do you translate prototypes into operations? How do you make it real?
Absolutely. It's a great question, an important question. So, for instance, on the prosthetics and assistive technology challenge as an example, what we're now doing is we're actually working with not only the employees, but also veterans themselves to teach and train them on these skills such as 3D printing or additive manufacturing. And our vision is that not only we'll have this internal competency for actually taking these prototypes and implementing them in practice so that VA employees can interact with veterans, but we're also hoping to teach and train veterans on the skill set as well for a couple of different reasons. Self-care and being able to provide the services to yourself is a very empowering thing, but more importantly, the ability to learn this new 21st century skill, such as 3D printing and additive manufacturing, is something that can also be used for them to go get employment or a job. And so what we're also doing is we're working to get veterans teach and trained on these skill sets so that they can build these devices themselves with either resources at the VA or with the surrounding community. But to more broadly answer your question, that is one of the roles of the innovation specialist on the ground as well. It's not just on working with employees to help teach and train them, but they can also be the facilitator so that when an innovation has shown value at the prototype stage, that they can then work with the local stakeholders, whether it's the service line leadership, the different employees, to get it tested and implemented in practice. And then once that innovation is deployed and has shown value, then through the tiered funding mechanisms that I mentioned, that they can then spread that and diffuse that innovation to other sites. Kaiser's developed a pretty incredible model with this. They use this concept of change packets, which summarizes how the innovation was deployed and tips and tricks for further implementing that innovation at your site. And so we are following a similar model to Kaiser so that as innovations move from the prototype and move to the product stage, they can then get implemented with the support of the network.
Andrea, I'm going to actually, so I've got a number of questions here, but I'm going to skip ahead to one because I think it actually follows up on a point you just made, and it may be useful to answer that now. And it's, I'm concerned about the approach because it centers on VA employees rather than the actual veterans. It risks missing pain points which may be very acute for the veterans in favor of resolving employee issues. Can you comment on why you didn't pursue interviews with veterans? And I think you touched a little on this, but it may be worthwhile to finish following that one up.
Yeah, absolutely, and thanks so much for this important question. So I actually, it skipped a step at the very beginning of the presentation because the presentation would have been much longer. But prior to interviewing employees, we actually went on a much longer interview tour across the United States, from LA to Nebraska to Michigan to Maine, and we went across to many other sites, and we interviewed veterans actually first. And based on that research, we came up with a number of different themes. And that research then spurred the development of this incredible organization called the Veterans Experience Organization at the VA, and it's part of Secretary Bob's My VA transformation effort. And that group is a very close collaborator of the Innovators Network. After that research, we then went back out to the field to understand how we can improve the employee innovation experience so that we could then develop solutions for the different needs faced by veterans. And then with our teaching and training by the innovation specialists, they're getting trained on human-centered design so that employees on the ground know how to do interviews and research with veterans. So it all started with veteran research. Then based on findings we heard about how we could improve the veteran experience, we then interviewed our employees, and now we're deploying this human-centered design training to employees so that they can develop veteran-centric solutions. So it actually all started with the veteran research, and then what it's doing is we're really using this teaching and training methodology to make sure that our patients, our veterans, and their supporters are at the center of everything we do.
So the next question, Andrea, is any insight on overcoming some of the legacy policies and cultural resistance to change, especially in a regulated space such as medical?
Yeah, absolutely. This is huge, and this is where I really fall back on human-centered design. So one of the keys of human-centered design is that you're co-designing with users and stakeholders. One of the very important stakeholders that is part of this is leadership and policymakers. So for us, we engage leadership throughout this process, and we're co-designing it with them, not only just with veterans and our users. So the way you do this, and Harvard Business Review actually has a great article that describes this in this past month's edition, is you involve the leaders early. So you show them the proposal for the work you're going to do or this new initiative, the research, your human-centered design effort. You validate with them that these are the goals for the research. Then you come back to them, and these are leaders or policymakers. Then you come back to them with your findings and ask if anything's surprising here. You further iterate on and have a discussion with them about what you heard from your users. And then after you have designed and tested a proposed solution based on your findings, you then go back to them and are constantly getting their feedback and up to date. And the notion is that if you co-design with the policymakers and with the leaders, then you'll obtain their buy-in throughout. Now, in a situation where there are just, to your question, there are just policies that are blocking you, you just always think about those constraints up front. If it's something that isn't movable, if it's something that is a true constraint, it's something that as you co-design, you have that in mind. And one very powerful tool, which sounds very simple, but as you co-design, you always go back to asking the question, how might we combat whatever policy change that is a blocker? And so that within your system of design, you are always thinking about what that constraint is and either innovating in and around it or raising it to leadership to show that in order for this to be successful, we need an update in XYZ policy. So this notion is that you're co-creating, co-designing with leaders and policymakers to help combat some of those challenges.
Great, thank you. The next question we have is, what types of courses or resources would you suggest to learn design thinking in depth?
Yeah, absolutely. It's a great question. So, so for me, I was very lucky to have folks on site that could help teach and train me, but there's a number of different organizations out there. In the federal government, we have a great collaboration with the Office of Personnel Management who deploys the design thinking training. But there's a number of different organizations out there. IDEO is one, and they have a great online program called IDEO University. Luma Institute is another. And there's a number of different conferences out there that really help provide a brief introduction to design thinking, whether it's health refactored in the healthcare arena. But I think if you look online, there's a number of different free resources or very cheap ones. One of the ones I mentioned was IDEO University, and also they have a great, Frog has a great playbook and handbook as well as IDEO. So I really leaned on those resources that are available online, along with coaching from my employees and also training from local government stakeholders. But I know that others have used more commercial trainings, which have been super helpful.
So the next question, actually I'll answer the next question that's come up, which is, is it possible to get a soft copy of these materials? And I just want to make sure everybody knows that both the slides and the recording of this presentation will be posted on our website within a week, and along with Andrea's email address. So if you've got follow-up questions or want to contact Andrea, we'll have that all up online as well. So the next question I have is, what communication/technology platform do you use to manage coordination challenges in your innovation activities? Do you use something like ASA/NA?
Yeah, it's a good question, and honestly, there's no silver bullet. So we use the Jive platform, which is called Pulse internally to VA, to have communications across our network. And this is a broader platform that VA uses that we take advantage of. The second is we use our Salesforce, which we've rebranded the Innovation Exchange among our team to help really manage projects, keep track of projects, and keep track of our ecosystem. But what I will say is so I was a Presidential Innovation Fellow, which is a wonderful program based out of the White House Office of Science and Technology and Policy, and also the General Services Administration. And GSA, or General Services Administration, has developed this incredible tech shop called 18F. And their developers, designers, and product managers are across the entire United States. And they actually use a lot of lessons learned from GitHub. GitHub, I think, close to 70% of their employees are all remote. And with that comes a need to be absolutely relentless with your collaboration and communication strategies. So if you're looking to get some advice in this arena, I would take a look at a recent post and video by GitHub that talks a lot about how they collaborate and communicate in this very networked organization that many of their employees work remotely. So that's just one tip.
So next question is, are the innovation specialists more medical or engineering focused? And is this their full-time position?
Yeah, great question. So this innovation specialist this is their full-time role, and we heard from employees that in order for this to actually get put into practice, that it needs to be a dedicated position, that it wasn't just something they could do off the side of their desk. And so we're trying two approaches there. We have the full-time innovation specialists at their sites, and this is close ties to a former innovation group I used to work in at the Brigham Innovation Hub, where they had full-time innovation staff. But with that innovation catalyst model that I mentioned that we're trying at the Boston VA, we're looking to develop a lightweight version of the innovation specialist so that folks can learn a new skill and do it at 10 to 20% of their time, and that way it helps build the capacity of this innovation specialist. And your other question about what's their background is it's a very diverse crew. Some are clinicians, some are engineers, some are engineers means a couple different things at the VA. Some are traditional developers. Others are actually engineers on the facility side. We also have members of our IT organization that are innovation specialists. So they take a very diverse backgrounds, but at its core, they're folks that have had experience in the innovation arena in either of those domains.
All right, I think I have two more questions, and then we'll cut it off just in the interest of time for those that are joining on a lunch hour. Have you considered applying the innovation crowdsourcing approach to healthcare structural systems design, i.e. structure, process follows structure, outcome follows process?
Yeah, it's a great question. So the Prosthetic and Assistive Technology Challenge was one of actually a couple open innovation challenges that were run at the VA. One actually was focused on care coordination, and especially on the IT informatics side of the house. And so I think open innovation challenges can be used for these structural changes. They might take a little bit different form. So for ours, we were looking for designs, specifically STL files for 3D printers. For something like what you're proposing, it would most likely have to be an ideation challenge. And so, for instance, InnoCentive has a number of different challenges you can deploy, and one of them is an ideation challenge where you can submit essentially a Word document where you propose a different design based on research that you've done and can provide references on. So depending on what challenge you're trying to solve, whether it's to your question, a systems level structural challenge, or it's an actual technology challenge, or maybe it's an algorithm challenge, there are a number of different platforms out there, and InnoCentive and GrabCAD are just one of them. And so depending on what you're trying to do, you can tackle it. And I know Health 2.0 and Luminary Labs have done system level challenges along with OpenIDEO as well. So it's definitely in the realm of possibility.
So I'm going to give you one more question, Andrea. Do you link innovation and improvement and implementation of activities, and if so, how?
Yeah, this is a great question, and probably the number one question we get. And I'm interpreting your question are how do innovation and human-centered design link with process improvement and lean and systems improvement? So the best way, and I can describe this in a very simple way that I describe this, is human-centered design and innovation come at the front end when you're deciding what you want to build and how to meet the needs of your users, where systems improvement and lean and process improvement come on the latter end when you're trying to figure out how to make something better, faster, cheaper. And the best way I know how to describe this, which was told to me by a system improvement person, was if you're trying to decide how to make a better hamburger or how to make a tastier hamburger, if you're trying to figure out how to make a more cost-effective hamburger, that's lean and systems improvement. If you're trying to decide if a hamburger is what you want to be eating to begin with, or what's the best thing to be eating, then you'd want to use innovation/human-centered design. So while that's somewhat of a generalization, that's how we've been linking our efforts so that human-centered design comes more at the front end, and once there's a system or product or process in place, then this is when lean and system improvement really takes off.
So I actually have one final question, Andrea, that popped up. If you've got an extra minute or two. It says, your organization structure seems to be a system of systems. Inherently complex organizations tend to resist change. What are some of the pain points you've learned in adaptation of human-centered design approach, and how do you handle legacy internal processes that oppose your present approach?
Yeah, this is a great question and something that we talked a lot about in SDM, System Design and Management, as a master's student. And the key is, first off, to my earlier point, is knowing who your stakeholders are and who you need to engage when. And so it's really critical that as you're designing a new system is that the stakeholders, whether they're decision makers or they're users or they're key enablers on infrastructure side, need to feel a part of the process. And they need to feel that their voices were heard and addressed. And this is good for a number of different reasons, but most importantly is so that they will adopt the initiative ultimately. And maybe they'll learn throughout the process. So it's really key when you're designing these systems of systems or system within a system is that you engage the stakeholders that are involved at the beginning, middle, end, and throughout to obtain their feedback, obtain their guidance so that they feel a part of the process. So that's a short answer to a much, much bigger question that I'd love to chat with you offline.
Thank you so much, Andrea, and I want to thank everybody for joining us on the webinar today. It's great to hear from somebody who's taken the MIT systems thinking and gone out and really made some significant change in an area that really needs focus. I do want to just remind folks that as I mentioned a little bit earlier, the slides and the recordings will post on the SDM website within about a week, along with Andrea's email address if you do want to contact her directly. I'd also like to just let our listeners know that our next webinar in this series is scheduled for November 2nd, and it's going to be presented by an SDM alum, Susie Livingston, who's a product manager at IBM. Her title and her focus is Understanding and Measuring the Impact of Enterprise Social Software on Business Practices. So once again, thank you very, very much, Andrea, and thank you for our audience for joining us for today's webinar.